Okay. So also I have posted the midterm structures list. This on Blackboard. So these are the structures that you're responsible for the midterm. They're 4 pages long. Most of the 2 pages out of the 4 are skull structures. So you should be in pretty good shape if you have known your skull stuff. And I also have a list posted last night for the anterior triangle structures that we're going to cover today in the lab. So you have the anterior triangle structures posted on Blackboard, midterm structures, 4 pages, all posted on Blackboard. So I hope you're going to be ready for the midterm exam on Monday. And the lab will be open till Saturday and will be possibly closed on Sunday. So we can prepare the exam. Okay? Also, I'm going to rearrange the lab. I'm going to rearrange the tables on Wednesday, and I'm going to put some markers where going to be the rest stops and question numbers, but not actual questions. This is pretty much what I got. So I'm going to ask you if you can be cooperative and don't move the tables around or the question labels that I have put, not the actual questions. Okay? So let's get today's lecture is going to be about the anterior triangle of the neck. And the neck is defined as the region that extends underneath the mandible, that's going to be the superior boundary of the neck, and extends all the way down to the top portion of the clavicle and extends all the way back to the acromion, and it will have the cervical vertebra at the back of it. So this is the neck region, and for simplicity we'd like to divide the neck into triangles, and we're going to look into that in a minute from now. But before we do that, we're going to look at a cross section in the neck region. If you have a cross section in the neck, you obviously will have the vertebral column in the back of your neck, and also you're going to have the associated neck back muscles around the vertebral column. And we talked about some of these muscles in the back of the neck regions when we studied the suboccipital triangle dissection in the first semester. So we looked at splenius, we looked at the semispinalis, we looked at all the muscles that we have in the suboccipital triangle, rectus obliquus. So all these muscles are part of the suboccipital triangle, all the muscles associated with the vertebral column. And we like to call the area where we have the vertebral column and the associated muscle the vertebral compartment. And the vertebral compartment does have a specific type of fascia that goes around it. We also have 2 vascular compartments on the side of the trachea, and these vascular compartments, they do have a specific fascia that is going around it, and these are going to be the jugular, the carotid artery, and part of the vagus nerve that is going to be within this vascular compartment. So we have how many vascular compartments in this cross section? 2. Yes, we have 2 vascular compartments, one on the right, the other one on the left. And these vascular compartments also have a specific layer of fascia going around it. The last compartments we're going to see in the neck, which is going to be more anteriorly, is going to be the visceral compartment. It will have the trachea, it will have the esophagus, and you can see some lobes of the thyroid gland on the side. So these are the compartments that you can see if you have a cross section throughout the neck region. Now there are major muscles that you can find in the neck, and these major muscles, we have discussed some of them when we talked about them in Gross Anatomy Part 1. Some of the muscles were positioning the head and neck, and you can find them around the vertebral column. Part of these muscles were the suboccipital triangle muscles that we talked about in Gross Anatomy Part 1. We also have the muscles around the cervical, they call it the cervical collar muscles, which is around the cervical vertebra that we can find. And we talked about these muscles. Other muscles we're going to discuss this semester are going to be the muscles of the pharynx that will help us to swallow things. The muscles of the larynx that help us to do the voice production, and also help us to do different breathing patterns that we might have. And also we have the strap muscles, and these are a bunch of muscles we have in the anterior neck region, which we will discuss in details today in this lecture. So we'll have a separate lecture for the larynx, we'll have another separate lecture for the pharynx, and today we're going to talk about the strap muscles that help to position the larynx and the hyoid bone in the neck. Now there are 2 procedures that are done to provide airway or provide air that is going to flow through the trachea, just in case we have an obstruction of the mouth or an obstruction in the pharynx or the larynx region. And one of them is actually done by incising the space within the larynx region between the thyroid cartilage and the cricoid cartilage. So this is the larynx, and we have the thyroid cartilage, which looks like a wings, two-winged, right here on the side, and there is a ligament underneath the thyroid cartilage, and underneath that ligament we have the cricoid cartilage, which is underneath that. So the incision site will be between the thyroid and cricoid cartilage, which will be at a ligament called the cricovocal membrane or the cricothyroid membrane. This is where you incise and insert a tube right here to enable a person to breathe if there's an obstruction up in the pharynx or in the upper mouth that is not enabling the person to breathe and bring air down to the trachea. And this is called ricothyrotomy, and that's what will happen to cut right here and insert the tube to help a person to breathe. But what will happen if we have an obstruction up there throughout the larynx region and you cannot incise right here and insert the tube? You need to cut an incision down there through the trachea. And that's exactly what's going on here. We have here an obstruction right here that is going in front of the larynx region, and this is where you have to insert the breathing tube within the trachea, a procedure called tracheostomy. So this is where you insert the tube to enable a person to breathe in case there is an obstruction that is actually blocking the airway and not letting a person to breathe properly. Now, other procedures that some people, this is really important, breathing is really important, and this obstruction may happen because of inhaling a foreign body like something solid. A person cannot breathe, and it happens more frequently in younger children since they tend to kind of throw everything in their mouth. But also it could happen as a part of anaphylactic shock or severe allergic reaction when people eat something and they get really swollen and they cannot breathe afterwards. If they usually EpiPen, that will help to facilitate or broaden the airways, but sometimes tracheostomy is actually performed to enable a person to breathe. Yes.
There's dental implications too, the occasional broken tooth or tooth fragment or extracted tooth or restoration is...
It might lodge in the airway. Yeah, a broken tooth might lodge in the airway and block the passage. But do dentists learn how to do that?
I think we learn. I've never had the call to do it.
Okay, so you have to learn it in the future to help just in case if a tooth falls in the airway.
And the students should look in the lab too. The trach is actually pretty small when we open through the chest. The trach is really not really big around it.
Yeah.
It's not hard for somebody with clot in there. It's a small opening.
Yeah, yeah. So you can practice on the cadavers in the lab as well. Yeah, that will be really tricky. Yeah. Now this is a picture that shows you an anterior view of the neck, showing the thyroid cartilage, the cricoid cartilage right here, and the cricothyroid ligament, which will be the site of incision if you need to insert the breathing tube right here. And also there's a bunch of muscles that we can find in the anterior neck underneath the hyoid bone, and we're going to talk about these muscles underneath the hyoid and the muscles that are going to be above the hyoid. Also behind the muscles you will find the thyroid gland hiding beneath with the arterial and the venous supply to it. Now we're going to come to talk about cervical nerves, and cervical nerves are simply nerves that are coming out from the cervical vertebra. Now, how many cervical vertebrae do we have in the neck? 7 or 8? 7. How many cervical nerves do we have? 8. Yes, so we have 7 cervical vertebrae, but we'll have 8 cervical nerves. And we talked about the roots of cervical nerves coming out from C5, 6, 7, and 8. And these were a root of nerves that come together and intermingle and make plexuses that is located right here. Do you remember the name of that plexus? Brachial plexus. Now, these brachial plexus involve creating cervical nerves that are C5, 6, and 7, and 8. What about C1, 2, and 3, 4? Then we'll make another plexus, which is called cervical plexus. So we have cervical plexus and we have brachial plexus. Brachial plexus are cervical nerves from C5 to C8 and possibly T1 involvement. And cervical plexus, they will be the anterior rami of C1 to C4. So Cervical plexus will supply the strap muscles, the diaphragm, and also the skin, part of the skin on the back of the head and part of the skin on the neck as well. And also part of the skin on the upper thoracic wall as well. So these are mainly the innervations of the cervical plexus, not only to supply the strap muscles, but also will supply the skin of the area that is going to be adjacent to it. And here we have a figure that shows you the innervation, the cutaneous innervation of the skin of the face and the back of the neck and the head as well. So the face is mainly innervated by the trigeminal nerve, cutaneous innervation. The back of the head we have cervical innervation right there. Also you have the neck region, which is also cervical innervation right there. So most of the cutaneous innervation of the back of the head and the neck is by cervical nerves. Now you can see right here in this figure how cervical plexus forms between the roots of C1 to C4, and they will go and provide most of the cutaneous innervation. Also, you can see part of these cervical nerves that will give out branches colored in green, and these branches right there, they loop around to make this structure called Ansa cervicalis. And Ansa cervicalis is the main innervation, that cervical innervation, that is provided to strap muscles. Strap muscles are the muscles that are located in the anterior part of the neck, and we're going to discuss them in detail at the end of this lecture. But this is what Ansa cervicalis are nothing but small branches of the cervical nerves that come together and make a loop around the anterior region of the neck and provide the innervation for the strap muscle. You also can see smaller roots that come out of branches of the cervical nerves that go out and descend down as the phrenic nerve. And we have studied the phrenic nerve previously. Does it sound familiar? What does it innervate? The diaphragm, yes. So the phrenic nerve will descend up from the cervical region all the way around the heart. You have one from the right, another one from the left, and that will provide innervation for the diaphragm. And this is where it comes from. Now also you can see right here brachial plexus, roots of C5 to T1 that comes together and make the brachial plexus right here, and we should have looked at it at gross anatomy part 1, and we have grilled you with the questions about brachial plexus last semester, didn't we? Yes, it was fun though. Yeah, while it lasted. Now let's look at the triangles of the neck. Obviously there are 3 triangles of the neck. We talked about one already. What triangle we talked about already? Suboccipital triangle on the back of the neck. Yes, now there are 2 more triangles, an anterior triangle and a posterior triangle. And the boundaries of this triangle is shown in this figure. First, the anterior triangle is bounded by the mandible superiorly, the edge of the mandible. Also, this is muscle, which is a very important muscle in the neck. You find it right underneath the platysma. This would be what muscle? SCM, sternocleidomastoid. And this will be making the SCM with the mandible. These will be the boundaries of the anterior triangle of the neck. Now for the posterior triangle, the boundaries are going to be the SCM, the trapezius muscle on the back, and the posterior 1/3 of the clavicle right there, and that would make the boundaries of the posterior triangle. Now also there's a structure called the axillary inlet, which will be part of the posterior triangle, but you can see it right here, a portion of it right there. Now we talked about the boundaries of the anterior triangle of the neck, and this slide talks about the boundaries of the anterior triangle. The next slide will talk about the boundaries of the posterior triangle of the neck and what structures passes through the axillary inlet, which are going to be nerves and blood vessels. And right here, here's another lateral view of the posterior triangle of the neck and the anterior triangle of the neck. And you can see this is the boundaries of the mandible. You count the muscles underneath the mandible as part of the anterior triangle with the hyoid bone as well. And that's going to be the classification. The hyoid bone is going to help us to split these muscles into 2 groups while we talk about it within this lecture. Now we talked about the carotid triangle before, didn't we? Yes, and I have put the slides before, but I flew through it. I didn't talk about it in details. But now I'm putting the slide again to alert you there are two important structures that are present within the carotid triangle. And the carotid triangle was an area within the anterior triangle that has the carotid artery before it bifurcates into an external and internal carotid artery. Now, why I'm putting this slide again? I'm putting this slide again to talk more about the carotid sinus and the carotid body. Now, how many people think the carotid sinus and the body are the same thing? Raise your hand. Two separate things? Raise your hand. Yes, they are two separate things, but located in the same region. The same region is the bifurcation of the external and the internal carotid artery. The carotid sinus contains receptors that monitor changes in the blood pressure. The carotid body has chemoreceptors that monitors the gas concentration such as oxygen and carbon dioxide content within the blood. So these are both structures that are present within the common carotid artery before the bifurcation into internal and external carotid artery. Now, the carotid sinus is provided in innervation by 9. The carotid body is provided in innervation by 9 and 10. So how about if I throw a question about this in the exam? Okay? Deal. There we go. And within the anterior triangle. And I'm going to show you this again within a couple of slides from now. Now here is the carotid sinus approximate location, and it's will be a little bulge that you can find within the carotid artery, and possibly I'm going to try to find it in the lab and show you an example about it. Here's the carotid triangle right here, and that's a region within the anterior triangle, and it's bounded by superior belly of the Omohyoid muscle, which we're going to talk about it. It's an infrahyoid muscle. This is the posterior belly of the digastric muscle and the SCM, the sternocleidomastoid, which make the boundaries of the carotid triangle. Are you okay? Yeah. Bianca? Okay. So, we're going to talk about the fascias of the neck, and there's a better way. The best way to talk about the fascias of the neck is to look throughout this figure. But the first thing I'm going to talk about before we're going to look at the fascias of the neck, that one of the external fascias of the neck we have already dissected in the lab. When we try to take the neck off, the skin off the neck, there's a lot of you who took the skin out and it came with it a very small muscle. Do you remember the name of that muscle? Platysma, yes. Now, that very thin muscle, platysma, which you should exercise before you get sagging wrinkles, is innervated by which cranial nerve? How many say 7? Raise your hand. Good. Some people are actually studying. Is innervated by the facial nerve 7. Yes. The external fascia, including the platysma muscle, this is the external fascia of the neck that contains the platysma muscle, which is really thin. That's why when you try to take the skin off the neck, most of the times you're reflecting the platysma muscle with the skin. That's part of the external outer fascia of the neck. Now, there is a deeper fascia, and there are 3 components of this deeper fascia, and we're going to see it within this figure. Now, when you look at this figure, we have this purple layer of fascia surrounding pretty much everything, and that deep layer of fascia underneath the external fascia is called the investing layer of fascia, which is colored in navy blue color. Now, if you look at the vertebral compartment, it has another layer of fascia, which is outlined in pink, and that's what we call what fascia? Pretracheal fascia. Prevertebral fascia. Prevertebral fascia. And that's the fascia that is going to be surrounding the vertebral column and the associated muscles with it. The prevertebral layer of fascia. Now, if we look anteriorly, we have the visceral compartment with the trachea, the esophagus, and some loops of the thyroid, and we have a layer of fascia that is outlined in orange. What do we call this fascia? We call it what? Yes, we call it the pretracheal layer of fascia. The pretracheal layer of fascia. So we got two down. The prevertebral, the pretracheal layer of fascia, and the last fascia is going to be surrounding the jugular vein, the common carotid, and the vagus nerve, and this is what we call the carotid sheath. And when you go to the gross anatomy lab and you try to separate the common carotid from the jugular vein, sometimes you're lucky to find the vagus nerve, which I found on table number 4 in the lab. You can find the vagus nerve. So if you didn't find the vagus nerve, I found it in table number 4 in the gross anatomy lab. You can find all the structures that are involved within the carotid sheath. So how many layers of fascia that we talked about so far within the neck? Most external one, then what? Investing layer, then we have the pretracheal, prevertebral, and then the last one is carotid sheath. So we have 4 layers of fascia within the neck. So would you think that will make infections spread easily within the neck? It will be really hard. It will be really hard to spread. Yes. Yeah. 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 You can call it this way too. Yeah. Mm-hmm. Now we'll move to the longitudinal or sagittal view that shows you all these layers of fascia starting from the investing layer after the external layer, and also you can see right here the pretracheal fascia right there, and there are spaces in between, and these slides will discuss it even more on when we're going to talk about the spread of infections and the facial planes, and that will be a topic of lecture on April 8th. So this will prepare you for the facial planes and spread of infections lecture on April 8th. Now, here you can see here a slide of the superficial veins of the neck. Sometimes if you're lucky you can see parts of the anterior jugular vein. Sometimes you can't, but you can see more clearly on the side the jugular vein on the sides with the common carotid artery. And you can see part of these veins spreading into different regions of the neck. One of the most veins we'd like to focus on is the facial vein, superficial temporal vein, retromandibular vein, and the maxillary vein. We also have the occipital vein going to the occipital region in the back of the head. So these all are the veins that we have to look at in the lab, and these veins have common path, exactly the same path as these arteries of different areas that we'll go through. Now we're going to look into smaller triangles within the anterior triangle of the neck, and these smaller triangles are going to be explained much better once we place this figure that talks about them. We have a triangle that is going to be underneath the mandible, so we call it the submandibular triangle. A triangle right under the mental region, right in front of the anterior belly of the digastric muscle, and that will be the submental triangle. We have the carotid triangle, which will be bounded by the SEM, posterior belly of the digastric, and the Omohyoid muscle, and that will be the area where you have the bifurcation of the common carotid into external and internal. We talked about it also in a couple of slides before. And the last triangle, which is going to be more anteriorly in front of the Omohyoid, and a portion, the inferior portion of the sternocleidomastoid, will be the muscular triangle right here. So we have how many triangles or sub-triangles within the anterior triangle of the neck? 4. Yes, we have 4 sub-triangles, small triangles within the anterior triangle of the neck. Now, speaking of these muscles that we have in the anterior triangle of the neck, these muscles could be divided into muscles above the hyoid bone and muscles below the hyoid bone, but there is a more proper way to collectively call them. The muscles above the hyoid, if you were speaking Latin, what would you call them? Suprahyoid. And the muscles underneath the hyoid, you will give them a name of infrahyoid. So we're going to look into these muscles in details and define them right now. Starting with the suprahyoid muscles, the muscles that you find above the hyoid bone, which you can see right here in the figure. And this is a figure that if we look up from the mandible from below. And that is another figure that if we have a lateral view of the mandible. Now there are 4 pairs of the suprahyoid muscle, and we're going to start talking about the stylohyoid muscle, which I haven't been lucky to separate yet in the lab, but I'm going to try to work my best and separate it today. Well, most probably if I found a model that has it really well, I could tag it in the exam. So stylohyoid, from the name of the muscle, it will originate from where? Styloid process, yes. And it will insert on the hyoid bone. So the name of the muscle tells you about the origin and the insertion of it. It will originate from the styloid process, and it will insert on the hyoid bone. And this muscle, since it's located at the stylohyoid, most probably when it's contract, it will help to pull the hyoid bone upwards. It would make sense based on the anatomy of this. If it contracts, it will pull it upward. So it does actually help in the swallowing process when it pulls the hyoid bone upwards. Now, the stylohyoids, we mentioned previously that it was innervated by cranial nerve number 7 when we talked about the facial nerve lecture. Moving up, we're going to talk about this muscle, which is has 2 bellies, an anterior belly and a posterior belly with 2 different innervation in the anterior and the posterior belly. And that's going to be the digastric muscle. And we're going to start talking about the anterior belly, which originate on the digastric fossa of the lower mandible. And it will have a tendon in the middle, and this is where the insertion is going to be. And the innervation of the anterior belly of the digastric is going to be by which cranial nerve? 7 or 5? 5. 5, which branch of 5? 3, which is going to be the mandibular division of the trigeminal nerve. So this is where the innervation of the anterior belly of the digastric. If it contracts, it will obviously help to lower the mandible a little bit, and that will help you to open your mouth, and it will raise the hyoid bone since the tendon is actually pulling on the hyoid bone. As for the posterior belly of the digastric muscle that we can see right here, it will originate on the mastoid process right here, mastoid notch of the temporal bone, and it will insert on the body of the hyoid bone. As for the innervation of the posterior belly of the digastric, it will be innervated by which cranial nerve? Facial, 7. And again, when it contracts, it will help to pull the hyoid bone backwards or upwards. Here is another figure that gives you the anatomy of the digastric, the anterior belly, the posterior belly of the digastric muscle. Now we're going to look at this muscle that is going to be providing the floor of the mouth, and that's going to be the mylohyoid muscle. And it's going to be very thin muscle. It's going to be at the floor of the mouth, and it will originate on a line that we have seen on the internal features of the mandible, and that used to be the mylohyoid line of the mandible. That's the origin of this muscle. As for the attachment part of it, it will be inserting, the fibers will overlap with each other, and that will form the insertion. But you can see very obviously that the mylohyoid does insert on the hyoid bone. And now the contracting of mylohyoid muscle will help to elevate the floor of the mouth. Since it's located there, it will also help to elevate the hyoid bone. Now, can you remember the innervation of the mylohyoid muscle? It came from a branch of which nerve? Part of the mandibular branch of the trigeminal nerve that will go to the mandible, and before it goes into the mandibular foramen, it gives the branch to the mylohyoid. What is that nerve that goes into the mandibular foramen that gives that branch? Inferior alveolar nerve, yes. Before it goes into the mandibular foramen, it gives the nerve to the mylohyoid branch that will supply the mylohyoid muscle.
It lies in a groove on that lingual wall of the mandible.
Now here's another figure that shows you the mylohyoid muscle at the floor of the mouth, and it attaches into the hyoid bone. And also you can see it right here from a lateral view, and you can see part of the submandibular gland kind of like loops around it. But you can see the submandibular gland really clearly in a lot of cadavers upstairs in the lab. You can see that also the sublingual gland is above the mylohyoid, right there. Now, there are a pair of muscles that you can find clearly once you are looking at the floor of the mouth from this side. So this is the dissection you're going to do in the lab. First, you're going to encounter the mylohyoid. If you dissect a little bit deeper behind the mylohyoid, really in the midline right here, you're going to see the geniohyoid muscle, which is going to be the next muscle we're going to talk about. Now, the geniohyoid, obviously, it will insert or attach on the hyoid bone. As for the origin, it will be from the inferior mental spine of the mandible. Remember the inferior mental spine of the mandible? These were the features of the mandible we asked you to memorize. As for the innervation of the geniohyoid, is actually innervated by the anterior ramus of C1, which has an overlapped fibers with the hypoglossal nerve. As for the function, it will function in two different ways depending on which bone is fixed. Now, the geniohyoid is attached to two bones. One of them is the mandible, the other one is the hyoid. So if it fixes the mandible, it will move the other bone, which is the hyoid. If it fixes the hyoid, it will move up the mandible. And that's how the function of this muscle work, depending on which bone is going to be fixed when it's actually moved. So if the mandible is fixed, it will pull the hyoid upwards. If the hyoid is fixed, it will help to move the mandible downwards and inwards. Here is another figure showing you the geniohyoid muscle right there. Now we're going to look at the infrahyoid muscle, which are way easier to see in the lab. And there are four infrahyoid muscles that we're going to talk about today, also called the strap muscles. And strap muscles are mainly innervated by the Ansa cervicalis. Here is a figure that's showing you the infrahyoid muscles. We're going to start talking about the sternohyoid. So sternohyoid is attached to or originate from where? Sternohyoid. Sternum. And it will attach where? Hyoid. So the name is giving you the location of this muscle, sternohyoid. And the innervation will be the anterior rami of the Ansa cervicalis. And the function of it, if it retracts it, obviously it would depress the hyoid bone a little bit downwards. Moving to the next muscle is the omohyoid, and it does have two bellies, an anterior belly and a posterior belly. And we're going to start talking about these two bellies in terms of their function and location. The origin of the anterior belly will be at the hyoid bone. The attachment will be the intermediate tendon right here. Actually, the origin will be at the intermediate tendon and the attachment will be at the hyoid bone. And then the innervation of it will be from the Ansa cervicalis as well. But if it contracts, it will help again to depress and fix the hyoid bone. As for the posterior belly of the omohyoid, it will be originating over there. What is located over there? The scapula, yes. So it will originate on the superior border of the scapula. Also called, written right here, superior belly of the scapula, but it will be superior border of the scapula. That's what we mean with it. And as for the attachment, it will attach itself to the intermediate tendon around the clavicle region. It looks like a little bit upwards there, but in the lab you can see it more toward the clavicle. Again, when it contracts, it will depresses and moves the hyoid bone again down. Now the second muscle we're going to look at is attached to the thyroid cartilage that you can see down here in the middle, and the other part is attached to the hyoid bone, so we'll call it the name of thyrohyoid. Now if you're going to look at the details of the thyrohyoid, what it does, attach itself on the thyroid cartilage. This is the thyroid cartilage, this is the lamina of the thyroid cartilage, and the attachment will be on the greater horn of the hyoid bone. This is what is a greater horn of the hyoid bone looks like. The innervation will be a branch of C1 overlapped with the hypoglossal nerve. The function will depress and raise the larynx, and it would depress the hyoid bone. Now the second muscle we're going to talk about is going to be attached to the sternum at the inferior border, and the attachment will be at the oblique line of the thyroid cartilage. So thus it will be called Sternohyoid. Sternohyoid. Now you don't have to memorize the name of these muscles. Well, you have to know them for the exam, but if you want to know them really easily, just look what is the muscle is attached to, what is going to, what is attached between which bone, and then you can name the muscle. It's between the thyroid and the sternum, you can call it sternothyroid. It's between the hyoid and the sternum, you can call it sternohyoid. So this is how you know these muscles in the lab, by looking what is attached and how would you name them. Again, is innervated by the Ansa cervicalis. Now, the anterior triangle is a delicate area of the neck, not because only you have the internal jugular, the jugular vein, and you have the common carotid, because also we have very important nerves that are passing through this region, and these nerves happen to be, most importantly, the vagus, the hypoglossal, the spinal accessory nerve, and also part of the facial goes around this region, innervating the platysma. So these are the cranial nerves that pass through this region, making this region really delicate. Also, you have two important branches that you can find other than the Ansa cervicalis that are going to be within the region. And these are going to be the transverse cervical nerve of the cervical plexus, which is going to be passing right over the sternocleidomastoid muscle. And we're going to show you a figure that shows you this pathway of this nerve. And we're going to see it in a couple of slides from now. It's not here yet, but we'll see it later on. But also because there are major blood vessels such as the jugular vein and the carotid artery as well, with the thyroid gland, with the other blood vessels that supply these glands. Now the Ansa cervicalis are going to be roots or branches of the cervical nerve C1 to C4 within the anterior triangle of the neck, and sometimes it gets a contribution from the hypoglossal nerve, and here you would see the Ansa cervicalis located right here in front of the jugular vein right there. So it does have branches from C1, 2, and 3, and it'll get the contribution from the hypoglossal nerve as well, and makes this loops of nervation that will supply the strap muscles or the infrahyoid muscle. Now here is again the transverse cervical the transverse cervical nerve that will provide cutaneous innervation of the area of the anterior triangle, and here's the figure showing you the transverse cervical nerves passing in front of the SCM muscle and supplying the cutaneous innervation. Now here we're showing you this figure to show you the blood supply for the thyroid gland. And the thyroid gland, why do we have to have a thyroid gland? What does it do? It secretes hormones which are what? Yeah, thyroxine, T3 and T4. And what will happen for people who don't have strong thyroid secretions or don't have the thyroid gland working? What will happen to them? That's if they're secreting too much. If they don't secrete at all, what happens to them? They gain weight, they become fat, and some of them become irritable, some of them they just don't care about anything in the world, and that's the kind of attitude I love to have. But I don't like to be fat though. So that's what happened for people who don't have enough thyroid secretion. Their metabolism will slow down, so that's why they will gain weight, and they will be sleepy all the time and feeling tired. Now for people who have an overproduction of the thyroid hormone, they will get skinny, they won't sleep much, they will be irritable, and that's what will happen when you secrete too much of it. So the thyroid gland is very important. But look at the thyroid gland surface. Is it smooth? But it's not smooth. It's heavily penetrated by blood vessel. You have 3 arteries that supply it, 3 branches of the arteries: inferior thyroid, middle thyroid, and superior thyroid, and also with the veins. and superior vein, middle thyroid vein, and inferior thyroid vein. So when you are operating in this area, you have to make sure that you're not injuring any one of these blood vessels are going to be around this region. It's not only that. You will have a branch coming out from the vagus nerve and going up there. What is that branch is called? Recurrent laryngeal nerve. That's a branch of the vagus that is going to be going around this region. And I have a girlfriend who had a tumor in her thyroid gland, and the surgeon have injured her right recurrent laryngeal nerve, and her voice after the surgery became muffled. One of these nerves were working, the other nerves was knocked out because of the surgery, so one of her nerves, her voice came out muffled afterwards. And that usually happens if you operate in the neck region, because it has so many tiny branches of nerves. You could cut one of them by mistake and causes a lot of some sort of a deficit caused by this nerve that is supplying this region. But also I've seen people who had some surgeries around the carotid artery, and they couldn't swallow on one side. They were drooping mucus from one side of their mouth, but then they regained function in a couple of months. It depends on the extent of the nerve injury they suffered post-surgery. But surgery in the thyroid region is very common. There's a lot of people who get it done, but they have to be careful. The surgeon has to be careful to do the surgery really carefully and not injure any nerves going on around here. Now, not only we have the thyroid gland in this region, we do also have 4 little parathyroid glands. And the thyroid gland is usually big, and it has 2 lateral lobes around the trachea. And also it does have a median outgrowth to the base of the tongue with the foramen cecum. And we're going to try to see the foramen cecum later on within the gland and show you the thyroglossal duct that will be connected to the foramen cecum. Now this figure shows you the parathyroid glands, and there is actually 4 of them, and you can see them when you look at a posterior view of the trachea, of the larynx, and so it's really hard to see the parathyroid glands, and they secrete one hormone called the parathyroid hormone, which will have opposite function to calcitonin gene related protein. That's physiology. You don't have to know about it till physiology talks about it. But here you have here some of the branches that will supply the thyroid gland, the superior thyroid, inferior thyroid. And the superior thyroid is a branch of the external carotid. The inferior thyroid is a branch of the thyrocervical trunk, which is the first part of the subclavian artery. As for the venous drainage, we saw the superior thyroid and the middle and inferior thyroid veins, what we talked about already, and with the recurrent laryngeal nerve that comes as a branch of the vagus nerve. And here you have here this figure of the parathyroid, the posterior aspect of the trachea, repeated right here, and this is the last slide that talks about the parathyroid glands. And that pretty much concludes today's lecture. Yes, I can.